Hello, everyone. My name is Jonathan Kenyon, and I'm going to be sharing with you some of my research for my capstone. So, the focus of my research was student health, specifically how their health relates to their healthcare access and how that relates to their academics. So, here's an outline of what we're going to be going over in this PowerPoint. After the introduction, I will briefly go over the current healthcare situation in the United States. We're going to discuss the data and use the results to come up with some possible improvements. All right. So, how did I come up with my topic? I had actually been discussing student health with Dr. Essery back in 2019, and we acknowledged that some students might not have as equal access to healthcare versus other students. And we were curious as to how these differences might manifest in students. I've never conducted any wide scale primary research before. So, to me, at least, finding the answers were not feasible. So I left it at that back in 2019. But Dr. Essery, explained to me how such a project could be accomplished using tools that are already available. So that's when I decided to give that a try and find the answers. So let's start by introducing this concept of underinsured. This is different from being uninsured because the underinsured do have a policy that provides coverage for medical expenses. However, someone is underinsured if they have difficulty covering their medical expenses. These individuals might delay or even forego necessary health care because of these expenses, despite their status as being insured. The CDC reports about 13.3% of Americans have no health insurance. And this number varies a little bit from state to state, with Texas having the most uninsured at 25%, and New York having the least uninsured at about 7%. According to the CDC, 86.7% of Americans are insured, but about 29% of the insured are categorically underinsured. So my objectives were to compare the overall health of students at Cazenovia with students across the nation. So if Cazenovia is an outlier in terms of health of the student population, that's important to know because that affects how we can interpret the rest of the data. Another goal of this research was to see if there's a correlation between academic performance and the health of the student. The results were used to identify areas of weakness in student healthcare and propose solutions. But the ultimate goal of the research is to open up a dialogue for students to talk about healthcare. In my opinion, college students seem to be left out of the discussion on healthcare. So, increasing awareness of the student healthcare issues might serve to bring them back into the discussion. So I sent out a survey to students asking them about their health, their use of the healthcare system, and factors that could possibly discourage them from seeking healthcare. I also asked students about their academic performance. The student health right in the middle. Okay. So the student health results were compared to a nationwide student health survey performed by John Elflane in 2018, and then their healthcare usage was analyzed for correlations between satisfaction of service and things that may have discouraged students from seeking healthcare and how that related to their academics. So now I'm going to share with you the survey results. In the end, over 170 students participated in the survey, but after going through the results, some responses were eliminated due to either duplicate submissions or incompleteness. So in the end, we were left with about 137 bona fide responses. The margin of error was calculated to be 7% based on the 137 responses collected from a population of about 1,091 enrolled students using a 95% confidence interval. Roughly 12% of Cazenovia students use the health insurer provided through the institution. I knew from talking with other students that a lot of them had used the school's health as the insurer. 1 out of 8 reflects about what I've seen from individuals around campus. So this graph might be of interest to you if you're in a teaching position, as most students, about 85%, miss 5 classes or less per year. So about 2.5 classes missed per semester attributed to illness. Most classes allow for about three absences without impacting the student's grade. So most students aren't disrupted by this. However, as many as 1 in 6 students do exceed this limit solely attributed to illness. So, who receives the bulk of medical treatment? Half of students reported two or less health visits within the last year. Some students receiving zero access to healthcare within the last year, with the bottom quartile of students receiving about one visit every 1.4 years on average. This corresponds with a quarter of students expressing dissatisfaction with their healthcare access, with these students potentially being categorically underinsured. The amount of time doctors allocate to students seems to be normally distributed, with students typically receiving about 15 minutes of attention, while scheduling conflicts were the number one reported factor discouraging healthcare access. Over a third of students attributed cost as discouraging them from seeking healthcare, higher than the reported 29% of Americans that are underinsured. So most students still use primary care office visits, despite the increasing availability of telemedicine and telehealth. Less than 8% of students currently utilize this feature. So, so I'm comparing the results of Cazenovia's survey with a survey done of students from across the nation, with over 25,000 college students participating in this nationwide survey from all 50 states. Here's how Cazenovia did. So this graph is information dense. The blue line represents Cazenovia. The orange line represents the results from the nation. Cazenovia pretty closely mirrors the results from the nation, with everything being within the margin of error. The highest variance seen is in sinus infections, differing by only about 4.8%. However, the average variance across all these was only about 1.2%. Students from Cazenovia did exceed the accepted margin of error, 95% confidence interval, in two categories of the self health rating, but not enough to be 99% confident. So now we're going to see some of the results of the statistical tests performed on the results I collected from Cazenovia. In the interest of time, I did not include every test, but the full results can be viewed in a copy of my paper. So the 7 factors discouraging students from seeking healthcare were cross-tabulated against their satisfaction with their amount of healthcare visits, using an analysis of variance. The approximate significance found being 0.001, meeting the criteria for being underinsured. Healthier students were more likely to express satisfaction with their number of annual health visits, regardless of the number of visits made. This makes sense because not everyone has the same healthcare needs, and students that do not receive healthcare access according to their needs would, of course, display poorer health status than those that do. There's also strong positive correlation between GPA and satisfactory healthcare access, with students that reported unsatisfactory access typically displaying lower academic performance than their counterparts. And now that we've seen the results, let's take a moment to discuss some of these out of pocket costs that students are reporting and how that relates to healthcare accessibility. While most students do not receive health insurance through the institution, the variables associated with out of pocket costs for students that do not use this insurance could only be speculated on. So I'm basing these prices on what is quoted in the institution insurer's student health brochure. Students pay a $15 copay for a primary care visit if the provider is in network. For 30 days of medication, students will have a copay anywhere between $10 all the way up to $40. Students are expected to cover about 10% of all costs if they are treated by an emergency room. If students use an out of network hospital, they must pay 30% coinsurance. Medications sourced to the network providers too. So if the student must be placed on a ventilator, which has been shown necessary for treating patients with coronavirus, the medical expenses from being placed on a ventilator could tally into the tens of thousands. And that does not include the critical service fee for your critical care for students in this condition, nor the basic emergency room charges. So a single trip to the emergency room may financially devastate a student, with most students' total savings being a fraction of the potential coinsurance payments. Now that we understand the potential dangers of being uninsured and how Cazenovia students fit into this category, we should discuss some potential solutions to bridge this underinsured gap. So, improving the implementation of telemedicine could serve to lower insurance costs and increase student access to healthcare. Telemedicine is known for improving accessibility by eliminating travel time and allowing patients to schedule and meet with their physicians in a much more convenient fashion. Telemedical visits are typically cheaper, costing about half the price of an in office visit. An estimated 75% of all in office visits can effectively be handled through telemedicine, with over 92% of students still utilizing in office visits. There's a massive room for potential savings by improving the implementation of telemedicine. The out of pocket cost barrier can also be reduced or eliminated through use of a healthcare subsidy plan. Students could use their school account to pay for out of pocket expenses not covered by insurance, similar to swiping your ID to pay for food in the dining hall. The plan could cover all annual out of pocket costs for up to 10 primary care visits, monthly medications, and one emergency hospitalization. And so this is just a theoretical plan. But assuming 100% utilization, the subsidy would cost about $642 per student. However, based on the median number of annual primary care visits and the data I collected, students would typically receive less than 6 annual primary care visits. An estimated 53% of students would undergo emergency hospitalization annually based on the emergency room usage of females and males between the ages of 15 and 24 years, as reported by the CDC. So the real cost per student is closer to about $292, which is less than the estimated cost savings from better health or telehealth communications. So, in conclusion, we discussed the national health crisis of the uninsured and underinsured Americans and how some college students fit into the category of being underinsured. The national health crisis is really finally being discussed